For thousands of years, African healers developed sophisticated medical systems that treated diseases, cured infections, and performed complex surgeries. Then Europeans arrived and labeled it all witchcraft to justify stealing the knowledge and selling their own medicines back to us. The truth is that modern pharmaceuticals owe more to African traditional medicine than any textbook will admit. Artemisinin, the most effective malaria treatment in the world, is derived from a plant that African healers used for centuries before Western scientists claimed the discovery. The rosy periwinkle from Madagascar now treats leukemia and Hodgkin's disease, yet the indigenous communities who first identified its healing properties received nothing. In ancient Kemet, physicians used moldy bread to treat infections thousands of years before Alexander Fleming supposedly discovered penicillin in 1928. African healers across the continent understood that certain molds had antibacterial properties and applied this knowledge while Europeans were still blaming disease on evil spirits. Ethiopian traditional medicine documented over 800 medicinal plants. Nigerian healers developed treatments for sickle cell disease. South African Sangomas created effective remedies for hypertension and diabetes. This was not superstition. This was empirical science developed over generations of observation and testing. The cesarean section was performed successfully in Uganda in the 19th century by traditional surgeons who used banana wine as antiseptic and anesthetic. When European doctors witnessed this, they were astonished, yet history credits them with pioneering the procedure. Colonial powers deliberately criminalized African medicine. They burned texts, imprisoned healers, and forced communities to abandon ancestral knowledge. Missionaries labeled traditional healers as witch doctors, creating a stigma that persists today. Meanwhile, Western pharmaceutical companies send researchers to document African plant remedies, patent the active compounds, and sell them globally for billions. This is called barbarism, and it continues right now. The World Health Organization estimates that 80% of Africans still rely on traditional medicine because it works. These healing systems survived colonialism, survived criminalization, and survived centuries of propaganda because they were built on real knowledge. African traditional medicine was never witchcraft, it was science. The only magic trick was convincing the world otherwise while stealing everything of value.